let's get you the view of health workers then and their expectations as the country is set to resume phase 1 of the Sisonke trial vaccinations for medical workers. The South African Medical Association's trade union spokesperson, Cedric Sihlangu, joining us now by Skype, I believe. Cedric, grateful for your time. So there'd been a lot of worry when the Johnson & Johnson vaccine was suspended as a precaution by government while the link with possible blood clots was being investigated. Are you satisfied that all the necessary safety checks have now been done and every question answered?
Thank you very much, Tumbigile. Firstly, I think we should welcome the recommendation by SAPRA, which is our regulatory authority, with regards to lifting the suspension of the Johnson & Johnson Sisonke vaccination program. We are indeed quite satisfied that, look, we do have one of the best scientists in the world, world-renowned scientists indeed. And the findings that came forth is that there is indeed a risk of 1 in a million in terms of developing this very rare clot-forming disorder. Medically, it's called vaccine-induced thrombotic thrombocytopenia. Now, from where we're sitting, as a union for doctors, we do view this risk to be extremely low compared to the benefit that comes with, having the vaccine disseminated to, the population at large so that we can reach herd immunity. So, indeed, from where we are standing, we are happy with the outcomes. In fact, the Johnson & Johnson vaccine is ideal in our setting in looking at the far-flung areas like our rural communities because, as it's been mentioned before, it's a single-dose vaccine, so that to us satisfies that we'll still be able to proceed with the Johnson & Johnson vaccination.
And Health Minister Zweli Mkhize on his update today said there are enough doses to vaccinate about 500,000 of the health workers in the country at the moment. As things stand, do you think that government will be able to meet that deadline to have vaccinated all healthcare workers by mid-May?
Typically, look, they say the proof of the pudding is in the eating. Look, we've had many, deadlines that we failed to reach. Looking at our current numbers, we're sitting at 292,000 vaccination up at the 13th of April. So, indeed, whilst there might be the doses available, the question is, are we going to be capable of, giving the doses to the healthcare workers as they so anticipate them? Now, we are worried in terms of the lethargic nature in which the phase 1 was rolled out. The many healthcare workers that still want this vaccine that still haven't gotten it, never mind the stoppage that we saw on the 13th of April. But with that said, we do hope that immediately as we begin rolling out again on Wednesday, we'll try and run as fast as we can to ensure that at least phase 1 is completed within the allocated time.
And how much anxiety, Cedric, is that causing amongst your members, the issue of the stop-and-start approach, if you will, to vaccinations, be it because of the issues that we had with the AstraZeneca initially, the J&J vaccines that have been arriving in tiny batches, and then, of course, the issues with the precautionary suspension to do with the blood clots?
We are sailing in uncharted waters, so to some extent, we've always anticipated that there'll be glitches here and there. Of course, it appears as though we in South Africa particularly seem to be having more of these than we desire. But further to just the Johnson & Johnson vaccine being available, we also welcome the procurement of the 30 million doses from Pfizer that also will be rolled out in the phase 2, which we anticipate should be starting in May. So I think all things said, we really are looking forward to at least catching up if it were possible.
And as far as side effects, have you had any cases of serious side effects or people who feel incredibly ill after taking the shot?
Look, from what we know and from the reports that we've received, there hasn't been any severe or major adverse events in South Africa. Hence, SAPRA also recommended that, look, we haven't even seen blood clots in our population. And as a result, we then got the green light to continue. So from what we know, we haven't seen any adverse or severe adverse effects in the population that has received the vaccine at this stage, which is the 292-odd healthcare workers. So to that extent, I think we've had a good outcomes so far with the J&J vaccine. And we hope that that will continue, because I think what is more important is that for us, it matters. Safety matters, and therefore we're not looking forward to having any adverse effect, in fact. So we do hope that even when the Pfizer vaccine gets here, we'll be fortunate to have no adverse events, and that's really what we hope for. These are all based on chance, as we've said. It's a risk-benefit, but we are confident that we should be having no adverse events.